You've probably heard that meditation can help you find calm, maybe ease some stress. But what if the latest science reveals it's far more profound than just, you know, chilling out? What if it's an active form of mental training, capable of physically reshaping your brain? Today, we're diving deep into the scientific framework of guided meditation, moving beyond anecdote and straight into the rigorous evidence. We've assembled a really comprehensive stack of sources for this deep dive. We've got cutting-edge research from institutions like the National Center for Complementary and Integrative Health, that's the NCCIH, a key U.S. government body researching these kinds of practices, and a host of specific clinical trials, too. We're here to show you what meditation really does.
Exactly. And our mission for you today is pretty clear. We're going to unpack the compelling evidence on meditation's true efficacy, explore its, well, sometimes surprising impact on your brain, outline the most effective ways to start or maybe deepen your own practice, and also critically address the important, often overlooked considerations around potential risks. This deep dive is really custom tailored to equip you with a truly informed, evidence-based perspective on how this ancient practice is meeting modern science.
All right, let's start where many people begin: stress. It's a common entry point for meditation, and for good reason. The science seems pretty robust there. What's truly exciting, though, is how rapidly rigorous studies like randomized controlled trials are expanding our understanding beyond just general calm. Even as the NCCIH cautions that some research is, preliminary, the sheer volume of new data is just undeniable.
Exactly. We're seeing increasingly compelling evidence, especially when it comes to mental and emotional well-being. For common challenges like stress, anxiety, and depression, meta-analyses consistently show that mindfulness interventions have moderate yet, significant effects. And to put that into perspective, a 2018 NCCIH-supported analysis found that mindfulness-based approaches were actually as effective as established treatments like cognitive behavioral therapy, that's CBT.
Right, CBT, which helps you identify and challenge those unhelpful thought patterns.
Precisely. And it was even comparable to some antidepressant medications for diagnosed conditions. That's a really powerful finding.
That is a game changer. And when we look at the gold standard, mindfulness-based stress reduction, or MBSR, that 8-week program, it consistently delivers significant decreases in stress, anxiety, and depression. We even saw a study where a simple mindfulness app at work led to improved well-being and decreased job strain. Pretty impressive. But here's an interesting twist from the research. Some studies suggest benefits might, well, wane without continued practice. So what does this imply about long-term effectiveness? What should you keep in mind?
That brings up a crucial point about consistency, doesn't it? And we'll definitely dive into that more deeply later on. But sticking with significant impact for a moment, for conditions like PTSD, the emerging evidence is also very strong. A landmark 2018 clinical trial with veterans found that a meditation program was actually as effective as prolonged exposure therapy, which is really a gold standard treatment for PTSD in reducing symptoms.
Wow, as effective.
Yes, and the meditation group even showed greater improvements in mood and quality of life. That's really a testament to its profound influence.
So, okay, beyond specific clinical conditions, it sounds like meditation really boosts general emotional health, too. The sources we looked at mention improved self-image and a more positive outlook, essentially enhancing your self-awareness by helping you disengage from those, harmful, self-defeating thought patterns we all get stuck in sometimes.
Precisely. And this ties directly into what researchers call internally focused emotional intelligence. That's the ability to truly understand and skillfully utilize your own emotions. And this foundational internal shift, well, it then mediates broader improvements in overall well-being. It's like building a stronger emotional core, really.
Okay, that makes sense. And what about physical conditions? Pain management often comes up. What does the science actually say there?
Right, pain. For chronic pain, like low back pain, MBSR has shown some short-term improvements. However, for conditions like fibromyalgia, the results are a bit more mixed. It underscores that effectiveness can vary quite widely depending on the specific condition. What's particularly fascinating, I think, is how meditation impacts acute pain. It seems to improve pain tolerance significantly more than it reduces the actual pain severity.
Huh. So you still feel it, but it bothers you less.
Kind of like that, yes. You might still feel the intensity of a sensation, but you're less distressed by it, or maybe it impacts your function less. It's about changing your relationship to the sensation itself.
Interesting. And what about cardiovascular health? You mentioned the American Heart Association noted only a possible benefit for blood pressure. That sounds a bit cautious.
You're right. It is a nuanced finding. The evidence for direct physical benefits, like lowering blood pressure directly, is suggestive, but it's not definitive yet. But if we connect this to the bigger picture, think about it. Many physical ailments, like psoriasis or irritable bowel syndrome, are well known to be initiated or certainly exacerbated by stress.
Right. Stress makes everything worse.
Exactly. And meditation's most reliable and robust effect is its ability to regulate that stress response and our emotional reactivity. So this primary psychological benefit then often leads to, well, variable secondary improvements in stress-sensitive physical conditions like blood pressure.
Ah, I see. So it's not a direct cure for the physical issue itself, but a powerful lever against the stress that contributes to it.
Precisely. It's a powerful stress management tool that then has this ripple effect throughout the body.
Okay, that clarifies things. What about sleep? Everyone wants better sleep.
Yes, sleep. Mindfulness meditation appears highly effective for improving sleep quality. Studies show its effects are actually comparable to established treatments for insomnia, things like CBT and even exercise. So it's a very promising tool if you struggle with sleep.
And here's one that surprised me a bit. Cognitive enhancement. Is meditation really like weightlifting for your attention span?
Research strongly supports that analogy, actually. One study showed just 13 minutes of daily meditation for 8 weeks significantly enhanced both attention and memory. And we see that experienced meditators consistently perform better on visual tasks and demonstrate greater attention spans than non-meditators. It really does seem to be a trainable cognitive skill.
Wow. This naturally leads to questions about age-related memory loss then. Does meditation hold promise there?
Well, the preliminary evidence suggests that various meditation styles can indeed increase attention, memory, and mental quickness in older volunteers. Specific methods like Kirtan Kriya, for example, have shown promise in some older studies for potentially mitigating age-related memory loss. It's pointing to some exciting avenues for further research, definitely.
Okay. Any other surprising conditions where meditation is showing promise? Before we move on to the how.
Absolutely. For substance use disorder, approaches like mindfulness-based relapse prevention, or MBRP, have been shown to significantly decrease cravings and help prevent relapse. For psoriasis, a systematic review found improved severity after 8 or 12 weeks of guided meditation. Again, likely due to its stress-reducing effects.
Makes sense.
And for cancer-related distress, mindfulness practices have significantly reduced psychological distress, fatigue, pain, and sleep disturbance in people undergoing cancer treatment. It can be a powerful support.
This really underscores just how multifaceted the benefits are across so many different domains. And the sources repeatedly point out, and this seems key, that these benefits are often enhanced when meditation is part of a structured program, rather than just pure, unguided practice alone.
That's a very important takeaway, yes. The structure and support seem to matter.
Okay, so we've seen how meditation helps across a really surprising range of conditions. But let's get into the how. What's actually going on inside our brains and bodies when we meditate? This is where it gets really fascinating, the neurobiology bit. It's not just passive relaxation, is it? It's active mental training, inducing something called neuroplasticity.
That's right. And what's truly remarkable are the observable physical changes in the brain. Consistent meditation leads to increased cortical thickness, that's like the outer layer of the brain getting denser in crucial areas. This includes the prefrontal cortex, which is vital for things like decision-making and working memory.
The executive functions.
Exactly. And also the anterior cingulate cortex, which is important for attention and emotional regulation. It's like those areas of the brain are physically getting stronger, more robust through practice.
And what about the amygdala? That's often called our brain's fear center, right?
Yes, the amygdala. Mindfulness practice can lead to a measurable reduction in both the physical size and the reactivity of the amygdala. Functional MRI, or fMRI studies, which measure brain activity by detecting changes in blood flow, they vividly show less activation in the amygdala when people view emotionally charged images after just 8 weeks of practice.
Only 8 weeks.
Yes. And this directly correlates with the reduced stress and anxiety people report. It's truly like turning down the volume on the brain's internal alarm system.
So it's not just, quieting the mind subjectively, it's physically reshaping the brain itself. What about how different parts of the brain talk to each other, the connections?
Right, that's the functional rewiring aspect. Meditation typically decreases activity in the default mode network, or DMN.
The DMN, that's the mind-wandering network, the internal chatter.
Precisely. That's the network active when our minds wander, ruminate, or get lost in that internal self-talk. Quieting the DMN is a direct neural correlate for being more present and less caught up in those loops. And at the same time, we see enhanced connectivity between the prefrontal cortex, the executive control center we talked about, and regions like the amygdala and the DMN. This strengthens the neural pathways for self-control and emotional regulation. It's basically improving the brain's internal communication and control system.
It really does sound exactly like a workout for the brain, building new connections, strengthening pathways, and this training directly improves attention, you said. How does that show up?
Yes, it strengthens what's called the executive attentional network. This improves your ability to maintain focus and inhibit distractions. And this improved focus isn't just subjective, it's observed even in challenging cognitive tasks, like the Stroop test. You know, the one where you have to name the ink color of a word that spells a different color.
Oh yeah, that one's tricky. So meditation helps you perform better on things like that.
Exactly. It demonstrates a tangible upgrade to your focus abilities.
Okay, fascinating. What about the chemistry? Hormones, inflammation, maybe even aging?
Good question. Meditation is reliably linked to lower levels of cortisol, our primary stress hormone. That's a very consistent finding. We also see higher levels of calming neurotransmitters like GABA and potentially increased serotonin and dopamine chemicals linked to mood regulation and feelings of well-being. It also seems to modulate the immune system, decreasing pro-inflammatory markers, which likely explains some of the benefits we see for inflammatory conditions like psoriasis.
Right, the stress connection again.
Exactly. And even at a cellular level, there is some preliminary research suggesting meditation may help regulate telomerase. That's an enzyme important for maintaining the ends of our chromosomes, the telomere.
Telomeres, right, linked to aging.
Correct. So regulating telomerase might potentially promote healthier cellular aging by buffering the effects of stress. This is still an active area of research, but it's very intriguing.
So, given all these profound neurobiological changes, what does this mean for the actual practice? How do you listening set yourselves up for success to achieve these benefits?
That brings up the important question about the core principles of practice, doesn't it? It's really about systematically priming your brain and body, creating the optimal conditions for this mental training to take root and flourish.
Okay, let's unpack this. Starting with the external environment. What's the ideal setup, especially for a beginner?
For novices, a quiet setting with minimal distractions is, well, pretty crucial. Eliminating interruptions just reduces the brain's cognitive load. It frees up that mental energy for the actual meditation itself. As your skill develops, you can certainly learn to meditate in noisier environments. That becomes part of the practice too. But to build that foundational focus, starting quiet is definitely your best bet.
Makes sense. And posture seems surprisingly important too. It's about striking that balance between relaxation and alertness. What should listeners aim for?
Right. Sitting upright, whether that's in a chair with your feet flat on the floor or maybe on a cushion with your hips slightly elevated, helps signal alertness to the brain. Lying down is excellent for deep relaxation, body scans, things like that, but you do have to be mindful of drowsiness. Sometimes bending your knees can help maintain wakefulness if you're lying down.
Ah, good tip.
And even standing or walking meditation can be really beneficial, especially if you're feeling restless or tired. The key is finding a position that's comfortable for you, but also keeps you alert and present.
Okay. And the breath, so often called the anchor of meditation. Why is focusing on the breath so effective?
Well, a few reasons. It's natural, it's rhythmic, and crucially, it's always available to you wherever you are. Plus, focusing on the physical sensations of diaphragmatic breathing, that belly breathing, directly stimulates the vagus nerve.
The vagus nerve. That's linked to the relaxation response.
Exactly. It's a key pathway for promoting the body's rest and digest response, the parasympathetic nervous system. And the core practice here, the real training, is to gently return your focus to the breath whenever your mind inevitably wanders, which it will.
Without judgment.
Without judgment. That gentle, non-judgmental returning is the fundamental repetition in this form of mental attention training. That's the push-up, so to speak.
I like that analogy.
Not the-
And the mental stance then,
Yeah.
that non-judgmental awareness.
Mm-hmm.
It sounds simple, but it seems absolutely foundational.
It really is. Allowing thoughts and feelings to arise and pass without getting entangled in them, without labeling them good or bad, is crucial. This trains your mind to be less reactive. It contributes directly to that down-regulation of the amygdala we talked about and the quieting of the default mode network. It's a key skill for developing emotional regulation and, ultimately, inner peace.
Okay, so once you have that foundation, the quiet space, the posture, the breath anchor, the non-judgmental attitude, how do you choose how to meditate? Like guided versus unguided?
Yeah.
Which should someone start with?
Yeah, that's a common question. It's often best viewed as a progression, not necessarily a rigid choice. Guided meditation is generally highly recommended for novices. Why? because it provides that external anchor that guides voice and instructions. This significantly reduces the mental effort required, especially when you're just starting out and your mind feels, all over the place.
Makes sense. It gives you something to follow.
Exactly. And research even shows that app-based guided meditations can be just as effective as in-person classes, which makes practice incredibly accessible for almost anyone now.
But what about when you get more experienced? Does that external guidance still serve the same purpose, or can it get in the way?
That's a great point. As you develop stronger attentional control, your internal cognitive load naturally decreases. You get better at focusing on your own. For more experienced practitioners, unguided practice can foster greater self-regulation and autonomy. It can potentially lead to deeper self-discovery because you're relying entirely on your internal awareness. For some, at that stage, external guidance can actually become a bit of a distraction, pulling them out of their own internal experience.
What's interesting, though, is you mentioned there's remarkably little direct research comparing the two head-to-head, although one study did show novice attention was significantly higher during the guided parts. Which makes me wonder, if you are using guided meditation, how important is the guide's voice itself? Does it matter who is guiding you?
That's a really important question, and the research points towards yes, it matters. The concept of a therapeutic alliance, that connection you feel with the therapist, seems to extend even to the disembodied voice in a meditation app or recording.
So, for instance, maybe preferring a human voice over a synthetic computer-generated one.
Right. Absolutely. Studies consistently show a strong preference for human voices. People report more enjoyment, find it more useful, feel more relaxed. It seems the brain processes natural human speech with less cognitive effort. It just feels more, natural and connecting.
And beyond just human versus synthetic.
Well, what's truly fascinating is that preferences are also influenced by factors like gender. Some studies show a general preference for female voices, though not universally. And even identity markers matter. There's research showing a significant preference among BIPOC communities, for example, for guides who share their cultural or racial identity.
Wow.
It's not just trivia, it's a critical insight for you when choosing a meditation app or program. Your connection or lack of connection to the guide's voice isn't just a nicety. A negative association can actually be a significant hindrance to your practice.
That really emphasizes the relational aspect, even if it's just a voice through headphones. Okay, what about the sonic environment? Music, nature, sounds, or just silence? How does that factor in?
Right, the background sounds. Calming sounds can certainly help. They can mask distracting environmental noises and provide a kind of non-linguistic anchor for your attention. There's evidence they can influence brainwave activity and modulate neurotransmitters. Music, especially classical or ambient, and nature sounds can effectively reduce physiological stress markers.
So they can be helpful tools.
They can be. However, it's worth noting that in studies with largely novice participants, vocal guidance was generally found to be the most effective intervention for improving mood and sleep quality, with purely silent meditation often being the least effective for beginners.
So sound can be helpful, but maybe not always superior to guidance, especially early on. And could it even become a kind of crutch?
Precisely. While background sounds can be very helpful, especially initially, the ultimate goal in many traditions is to cultivate internal awareness and focus without relying heavily on external aids. So it's a tool, but one to be used mindfully.
Okay, now for the big questions everyone asks. How long should you meditate each time, and how often? Is there some magic number for session duration?
Ugh. The million-dollar question. The truth is, there's no single optimal duration that applies to everyone. Expert recommendations range quite widely, typically anywhere from 5 minutes up to 45 minutes or even longer, depending heavily on your goals and your experience level.
So what does this mean for our listeners who are just starting out? Where should they aim?
For beginners, the advice is almost always start short. Maybe 5 to 10 minutes. Research shows that even 10 to 13 minutes daily can produce significant benefits like improved mood, attention, and memory. This suggests there's probably a minimum effective dose you can aim for that still makes a difference.
Okay, 10, 13 minutes sounds achievable.
Right. Now, longer sessions are common in structured programs like MBSR. They often require 45 minutes daily, and these longer durations are associated with very robust clinical outcomes, especially for specific conditions. So your specific goal really dictates the ideal duration for you. Stress reduction might need less than tackling chronic pain, perhaps.
And what seems truly paramount here, maybe even more than the specific duration of each session, is the power of consistency, isn't it?
That raises perhaps the most critical point. Consistency is almost certainly more important than duration, especially when you're building the habit. Just like physical exercise, frequent reinforcement strengthens those neural pathways we discussed earlier. Daily practice is ideal for really embedding those changes, but the absolute key is regularity. If you find yourself struggling to maintain, say, 20-minute sessions, it's far, far better to reduce the session length to just 5 or 10 minutes that you can do consistently, rather than forcing infrequent, longer ones you dread. Prioritize building the habit itself above all else.
Yeah, that's great advice. Build a habit first. And how long until you actually start seeing results? When can someone expect to feel a difference?
Well, some benefits can be quite immediate. Studies show mood improvements and stress reduction can happen right after a single session. You might just feel calmer or clearer right away. But those more profound, lasting changes, the shifts in brain structure and function, the deep-seated patterns, those typically emerge after consistent practice over time. 8 weeks is a time frame that comes up frequently in research as being sufficient for significant, measurable benefits to become apparent.
8 weeks. Okay, that gives people a benchmark to aim for while remembering consistency is key. All right, let's explore a bit beyond the basic practice. What about more advanced frameworks and some of the emerging technologies that can enhance or deepen the meditative experience?
Right. Standardized mindfulness-based interventions, or MBIs, like the MBSR program we mentioned, are a prime example of an advanced, structured framework. These are typically 8-week programs that don't just involve guided meditation, but integrate it with psychoeducation, learning about stress and the mind, and also mindful movement, like gentle yoga. And research suggests that MBSR, for instance, shows a more powerful effect on psychological well-being compared to just doing pure meditation alone. This highlights the synergistic effect of that multi-component approach. The structure and the integration matter.
And you also mentioned MBCT earlier, specifically for depression relapse prevention. How does that differ?
Yes, mindfulness-based cognitive therapy, or MBCT. It's a direct adaptation of MBSR, but it specifically teaches participants to change their relationship with negative thoughts and feelings. The goal is to observe them with acceptance rather than getting caught up in rumination, which is a major driver of depressive relapse. And there are other specialized programs too, like Learning to Breathe, which is adapted for emotion regulation in youth, and mindfulness-based relapse prevention, or MBRP for substance use disorders. It shows how adaptable these core mindfulness principles are.
Okay. Now, for some of the really cutting-edge stuff, virtual reality meditation. How does VR help, given that meditation is usually about turning inward? Seems counterintuitive.
It does seem that way at first glance, but VR can directly address common hurdles for beginners, especially things like environmental distractions and difficulty with visualization practices. A 2024 study, quite recent, found VR meditation was significantly superior at enhancing concentration, particularly for novices. It seems to work by offloading some of the cognitive work of maintaining focus and minimizing mind wandering. It essentially creates a very immersive, controlled environment for your mind to train in.
That's a fascinating application. And what about neurofeedback guided meditation? Getting real-time feedback on your brain activity. That sounds like a potential paradigm shift.
It absolutely is. Using advanced techniques like real-time fMRI, meditators can get objective feedback on their own brain activity. For instance, they can see how effectively they're downregulating their default mode network, that mind-wandering network.
So you see on the screen whether you're doing it right.
Kind of, yes. You learn to associate the internal feeling with the external feedback. In one pioneering study, this learned skill controlling their DMN activity translated into greater improvements in emotional well-being and mindful awareness in their daily lives, even without the scanner. This suggests a really powerful potential future pathway. Perhaps using VR initially for foundational concentration, then maybe neurofeedback for precisely modulating specific brain networks, and then eventually transitioning to proficient self-guided practice with those enhanced skills.
Wow, like having a personalized brain trainer.
Very futuristic.
Okay, so with all these incredible benefits and advancements, we absolutely need a balanced perspective. Let's talk about the downside. Are there risks to meditation that people need to be aware of? This isn't always discussed.
That raises a really important question, and you're right, it's often underreported or glossed over. Meditation isn't universally benign. A significant 2020 review found that approximately 8.3% of participants across various studies experienced some kind of negative effect, and that rate is notably similar to the rates of adverse effects seen in other psychological therapies, like talk therapy.
8.3%. That's not insignificant.
No, it's not. And some individual studies have reported even higher rates depending on the population and the type of practice. It's crucial we acknowledge this reality.
Okay, so what kinds of negative effects are most commonly reported? What should someone potentially look out for?
These are generally called meditation adverse events, or MAEs. The most commonly reported are psychiatric events, things like increased anxiety or panic, sometimes worsening depression, increased fear, experiences of dissociation or depersonalization, and in rarer, typically more extreme cases, it can involve psychosis or delusional symptoms.
Wow. Okay.
There are also somatic events, things like increased physical tension, headaches, or pain, and cognitive events, such as disorganized thinking or difficulty concentrating outside of the meditation practice itself.
What are the key risk factors for experiencing these MAEs? Is it linked to certain types of practice or perhaps certain individuals are more vulnerable?
Both seem to play a role. The most severe adverse events are strongly associated with intensive meditation retreats.
Intensive retreats, like meditating many hours a day.
Exactly. Practices involving many hours of meditation per day, sometimes combined with factors like fasting, social isolation, or sleep deprivation. Those conditions seem to significantly increase risk. Also, pre-existing severe mental health conditions, like a history of psychosis or significant unresolved trauma, can increase vulnerability, especially when practicing in unguided settings without proper support. And critically, the quality of instruction matters. Unqualified or inexperienced instructors are definitely a significant risk factor.
So given that, it seems crucial to distinguish between what might just be a challenging experience, which can be part of the process, and a truly harmful adverse event. What's the practical difference?
That's a vital distinction. Increased awareness of uncomfortable emotions, difficult thoughts, or even physical pain is often an expected, even therapeutic part of mindfulness practice. It's about learning to be with discomfort with equanimity without reacting automatically. That's a key skill being developed.
Right, that's part of the training.
Yes. But when these experiences become overwhelming, persistently distressing, start impairing your daily functioning, or lead to severe psychological states like those we mentioned, they cross the line into being harmful MAEs. The key distinction really lies in the severity, persistence, and impact on your overall well-being and ability to function.
Okay, so given these potential risks, what are the main recommendations for safe practice? How can our listeners mitigate these possibilities while still exploring the benefits?
First and foremost, seek qualified and experienced instructors, especially if you're considering any kind of intensive practice or retreat. Do your homework on the teacher or program. For beginners, the advice is always start slow. Gradually increase duration and intensity. Avoid jumping into intensive retreats right away. Individuals with a history of severe psychiatric conditions like psychosis or complex trauma should absolutely consult with a qualified healthcare provider before beginning any meditation practice, especially unguided practice. And finally, informed consent is vital. Practitioners and anyone teaching meditation should be aware that difficult experiences can and sometimes do arise. It's about being prepared, knowing when to ease off, and seeking support if needed. Practicing responsibly is key.
That all sounds like very sensible advice. Okay, so wrapping this all up, what does this deep dive really mean for you, our listener, whether you're just curious about starting or perhaps looking to deepen existing practice?
Well, if we connect all these threads back to the bigger picture, I think it's clear that meditation is best understood as an active form of brain training, not just passive relaxation. It takes effort and intention. We've seen that consistency is paramount, likely more important than the duration of any single session. Build the habit. The best practice isn't one size fits all. It's highly personalized, and it should evolve with your experience and your goals. And finally, safety through qualified guidance, self-awareness, and knowing your own limits is absolutely crucial.
Okay, let's try to distill everything we've unpacked today into a kind of step-by-step guide. Something practical you can use to begin or enhance your own meditation journey based on the evidence. So step one, define your goal. Ask yourself, what do you genuinely want from meditation right now? Is it stress reduction, better sleep, sharper focus, something else? This goal should really shape the technique you choose and how long you practice.
Right, get clear on your why.
Step two, choose your modality. For beginners, the evidence we discussed strongly supports starting with guided meditation. It provides that essential external anchor and reduces the initial mental load.
Use the support available, especially early on.
Step three, select your guide and platform. This is important. Find a voice, whether on an app or recording, that you find calming and trustworthy. Look for diverse instructors if that feels relevant to you, and ideally, evidence-based programs. Your personal connection matters.
Don't underestimate the impact of the guide's voice.
Step four, establish the foundation. Find that quiet space where you won't likely be interrupted. Adopt an alert yet comfortable posture. Typically, sitting upright works well. Start with a short, consistent duration you can stick to, like maybe 10 minutes daily. Remember, consistency trumps duration initially.
Build the habit, small and steady.
Step 5. Practice with an open attitude. This is key. Don't try to force your mind to be empty. That's not the goal. The mind will wander. That's just what minds do. Simply notice when thoughts arise and gently, non-judgmentally return your focus to your chosen anchor, like the sensation of your breath. Patience and self-compassion are absolutely essential here. Be kind to yourself.
The returning is the practice, not the absence of thoughts.
Step 6. Monitor your experience. Pay close attention to how meditation is affecting you, both during and after practice. If you experience persistent, distressing, or functionally impairing negative effects, don't just push through. Reduce the intensity, maybe try a different technique, or importantly, consult a qualified mental health professional.
Listen to your own system. Safety first.
And finally, step 7. Evolve your practice. As you gain skill and confidence over weeks and months, feel free to explore longer durations if that feels right. Maybe try different techniques, focused attention, open monitoring, loving kindness, or gradually move towards more unguided practice if you desire deeper self-reliance. It's a journey of continuous learning and adaptation.
Let it grow with you.
This deep dive really reveals meditation not as some static endpoint, but as a dynamic, deeply personal journey, backed by some truly fascinating and rigorous science. The ultimate goal, it seems, isn't just quietude, but potentially a profound re-engineering of your mind's capabilities and your relationship with your own experience.
Absolutely. And what's truly fascinating, I think, is that the journey of meditation isn't really about reaching some fixed destination, some state of permanent bliss or perfect stillness. Instead, it's much more about continually refining the skill of being present, of being fully aware, with acceptance and curiosity moment by moment by moment.
So here's a final thought for you to consider. If consistent evidence-based practice can physically reshape your brain and profoundly shift your internal landscape, what hidden potentials within your own mind are waiting to be awakened by just a few minutes of daily focused attention?